can confirm the scene is safe.
Hello, Chris.
My name is Jamie and I'll be your nurse for today. Today I'm going to show you how to properly use your inhaler with your spacer. First, I need to confirm your identity. Can you please tell me your full name and your date of birth? Alright, so your full name is Chris Brown and your date of birth is 29th of the 5th, 1995. Your address is 10 Carbis Bay, Reading, postcode RG810RK. And do you have any allergies, Chris? Alright, I see. So you are allergic to pollen. I confirm that I have the right patient, and before that, I'm just gonna prepare my equipments. Prescription chart for Chris Brown, address 10 Carbis Bay, Reading, postcode RG810RK, date of birth 29th of the 5th, 1995. Allergies, pollen, medication salbutamol, dose 100 microgram, 2 puffs, date and time today at 12 o'clock. Prescriber Dr. Muhammad, signature of the doctor and date today is present. I can confirm that the prescription chart is complete, signed and dated, and is due my time, and I'm happy to proceed. I have here my equipment. So this is the spacer. I can see that it is dry, clean, and intact, and it is within 12 months, so I can still use it, and I'm happy to use this one. Next is I have my salbutamol. I can see that this is, the expiry date is 2023, and this is 100 micrograms, so I'm gonna give 2 puffs. So first we need to open the cap. So make sure that there are no obstructions or some foreign objects inside it, and you make sure to shake it for 2 to 5 seconds. 2, 3, 4, 5. And then we're gonna use the spacer. We're gonna use this one to help the medication go through your lungs, because if we're not using the spacer, it might lodge into your throat and to your mouth. So next, you're gonna attach the inhaler to your spacer and make sure to open the cap. So after you attach this to the spacer and the inhaler, first you need to exhale and then put your mouth into the mouthpiece and make sure there are no air escaping through the mouthpiece. And then you need to depress the canister once. After depressing the canister, you need to breathe. We have 2 techniques on how to inhale the medication. The first technique is the single breath and hold technique, in which you're going to hold your breath for 5 to 10 seconds, and then before you exhale, you remove the spacer and exhale through a pursed lip. The second technique is the breathe in and out normally, or what we call as the tidal wave breathing. In this technique, you are gonna breathe in and out normally for 5 cycles, and before you exhale, you need to remove your spacer and then exhale through a pursed lip. Which do you prefer, Chris? So did you understand the instructions, Chris? Alright, so you're happy now to do the first puff? Well done, Chris. So now we're gonna rest 40 to 60 seconds because it is the same medication. However, if it is not the same medication, we have to wait for 2 to 3 minutes. All right? Okay. And you make sure to shake it for 2 to 5 seconds. 2, 3, 4, 5. And then we're gonna use the spacer. Do you want me to repeat the instructions, Chris? Or are you happy to proceed with the second puff? Okay. Well done, Chris. So now I'm just gonna give this to you. You can keep this one and you can clean it with soap and water. So this is just for your use only, all right? So before I leave, I will just document what we had done today, and I'm gonna leave you my number. Is that all right? Okay. Okay, Chris, do you have any concerns before I go? All right, thank you.